Okay, it's recording. So I was hoping we could start by introducing ourselves. So my name is Gaayatri Trehan, and I'm a grade 11 student at the Singapore American School. And in our school, there is this class called the Catalyst program, where a student is allowed to create anything they want based on something they're passionate about. And I'm really passionate about cancer research, and I really want to do medicine, preferably oncology in the future. So my goal was to create an app aimed towards connecting cancer patients and champions in Singapore. Um, yeah, would you like to go next?
Just a sec, let me just, there is a lighting thing and a lighting issue. Yeah.
Sorry for the loud noise. It's raining outside. So would you like to introduce yourself?
Okay, so I'm Dr. GEETA Kadayaprath, and I'm a breast surgical oncologist at Max Hospital in Delhi.
Wow. And Meenu auntie, would you like to go next?
Well, I'm one of her patients, and I'm a breast cancer survivor. It's been almost 10 years, and all thanks to the doctors that we are still living and enjoying our lives.
That's amazing. Okay, so my first question is, being a breast cancer surgeon yourself, have you noticed an increase in cases since the pandemic?
So it's not since the pandemic, it's just that the cases are rising, especially in our part of the world and in India. We are seeing an increased number of cases, but since the pandemic, what has happened, what has changed is that we're seeing more cases coming in advanced stages, all because most patients chose to stay back at home and not report to the hospital for fear of contracting the COVID. So that is what has changed since COVID began.
So how are cancer patients at a higher risk of obtaining COVID-19? Is there some correlation?
So cancer patients per se are not at a higher risk, but those patients who are undergoing chemotherapy, there is an issue because during chemotherapy, your immunity is low. And once your immunity is low, obviously you tend to contract all kinds of infections. And so you are more prone to even COVID, in the sense that, there are other people who may actually have come in contact with COVID, but never contracted COVID, primarily because their immunity was good enough to ward it off.
Yeah.
But if there is somebody who's having chemotherapy, the counts are low, the immune system is kind of taken a beating, and then they get exposed to COVID, their chances of contracting the infection and behaving badly, from hence on, is more likely.
Oh. So are cancer survivors also at a high risk of obtaining COVID-19 because of their weak immune systems? Or is it more so?
Really? So once you're done with treatment and, 6 months down the line, you are basically quite a bit recovered. There are some who don't, in the sense that, if their marrow has not behaved well during treatment and even after that, and their counts continue to be low, they're far and few. But once your bone marrow has recovered, your counts are back, your immunity is as good as anybody else's.
Okay. So since COVID-19 is such a highly contagious disease, going to the hospital at a time like this is quite risky. So how can cancer patients or survivors continue with their treatment and checkup, yet possibly avoid going to the hospital for them? So is there like another form of alternative treatment they can do?
So there are two groups essentially who need to visit the hospital. One who's been recently diagnosed or thinks that there is a problem and wants to visit the hospital. They are one group, and the other group is the follow-up group, those who've been through the treatment and need to be on follow-up and need to be checked at regular intervals to make sure that everything is fine. So for the first group, where you suspect that there is something wrong and you've been holding back your visit to the hospital for fear of contracting COVID, my advice to them is that you cannot hold off cancer forever. You have to visit the hospital. And the idea is essentially that you have to take precautions. So, we are going to the hospital every single day, and our hospital has got beds reserved for COVID. and you've been in that environment for 8 months, and thank God, so far so good, like I keep saying. But the thing is, you have to take the necessary precautions. And I think in all those things that we say, that the mask is the most important thing. But when I say mask also has to be used correctly. If you wear a mask and you keep touching the front, keep adjusting your mask, remove the mask, touch your face, it's of no use. You just have to be very, very conscious of the fact that once you've worn the mask, you're not touching it from the front. You're either using the strings to just adjust the mask and doing nothing else. And then the sanitization bit, in case you think you've breached that rule, you must have the sanitizer with you to be taking care of your hands. And the third thing is obviously social distancing. Now people scoff at it, but the thing is, we are seeing the problems associated with this, letting yourself a little, you lose, in the sense that you have given up on those precautions, and we are paying the price for it because we're seeing a surge in the numbers of COVID happening in our country.
Yeah.
So that group of people have to come to the hospital, take these precautions and see the doctor, because you cannot wish COVID away, and COVID is not going away anytime soon. This is what it looks like. So, and you cannot, and cancer cannot wait. So they have to come in and show themselves, take the necessary precautions and get going. There is no two ways about it. The second group, which is the follow-up group, there you can take a few, concessions, in the sense that you go for an online consult. You can do your tests in a diagnostic center closer to a house, which does not require you to come to the hospital. And then, at an opportune time, when you think that things are better, you can walk into the hospital for a physical check, which is very, very important for cancer patients who have been treated.
So how beneficial are these online checkups? Or yeah.
Yeah, so in the zone where you have nothing, I think the online consult works well, because, at least there is something, you are at least communicating with the doctor, and the doctor is trying to make out something from what you're trying to say, and then possibly advise investigations. And then, they can come back to you with those investigations, and you can just do a quick run through those investigations and see if everything is okay. And I think that reassurance is also very, very important, because patients do start feeling uncomfortable when they've been away from their follow-up checks for a very long time. So I think it is the best substitute for for a physical presence in the hospital. So I think it works well for whatever it is.
But a newly diagnosed cancer patient, for example, they should not consider postponing their treatment due to COVID, right? Okay.
Absolutely not. They should not postpone treatment, because we don't know how long this is going to go. There was a patient on whom I had put her on hormonal treatment, because that is allowed in a case of breast cancer, and she was doing all right. And after 6 months, I decided to operate her, did a surgery, and then she did require chemotherapy because she was node positive. But while on chemotherapy, she contracted COVID. So all that, the treatment that we tried to do to keep her away from hospital was brought to naught, because eventually she did contract COVID in the hospital.
Yeah. How is she doing now?
Oh, she's fine. She's fine. She just came back yesterday. More, she's more confident now because she's done with it, and she was not very symptomatic. She is still on chemotherapy, and she's doing fine.
Okay, that's good to hear. So what I've learned from other cancer champions that I've spoken to is that cancer treatment can really take a toll on someone mentally and physically. So Meenu auntie, how did you cope with the challenges of your treatments, and do you have any suggestions regarding that? Oh, you're on mute. Yeah.
Yeah. See, what happens is whenever you have any challenges in life, I guess it's always the people around you that also influence you. And especially in a treatment like cancer, you do need the family support with you, right? So if the family is there, if they are around and they know that you are going to come out of it, your confidence doubles up.
Yeah.
And of course, the doctors. So you have to just go with the flow. You have to just trust your doctors completely. You have to be with the family. You have to feel that love and affection and everything. I think that's all that you need for the treatment. Rest the medicines do. So there are challenges, But yes, the family support is the biggest support that you can ask for.
Yeah. So, what advice do the both of you have to support cancer patients and survivors during a very stressful time like this, both mentally and physically?
I think ma'am would speak first.
Okay. So if you were to look at this, it's not a disease which affects only an individual. I always think that a diagnosis of cancer affects the house. The entire house just comes down for a little bit of time till they come, get used to the idea and come to terms with the diagnosis. They tend to be all at sea, and it is as if the world has come crashing down on them, which is the uniform kind of feeling that we see with most patients. It is only once they enter into this treatment zone that they start thinking about how to work around this new situation for which nobody ever is prepared. So I think it is the family, the immediate family, because I don't um, conform to the extended family norm, because they can be actually counterproductive, because you don't know who thinks what and how they behave and how they contribute to you in, they've got a lot of negative connotations to that. So you have to choose the people you want to surround yourself with. This is something that's an absolute yes, because a lot of times what happens is you don't choose, you just let anybody and everybody walk into your life and tell you things which you don't want to hear, because you really can't cope, because this is disease by itself is big enough for you to be spending all your energies trying to cope with just that disease, rather than cope with remarks and statements that you don't need to deal with. So that is very, very important. And I think from the caregiver's perspective also, it is important to educate them, because it's a tough ride for them, because even they are in this new situation, they don't know how to handle it. So caregivers also need to be held through this process. And one of the things that I strongly believe, and I'm sure Meenu will also second it, is a support group. So whatever I may convey to a patient in terms of what this treatment entails and how it's not a breeze. We all know it's not a breeze, and I don't say that it is a breeze. I just say that yes, it is going to be a difficult time, but we will get past it. But even then, she does not want to believe me. But if there is somebody who's been through that journey and she were to say, look, this is the way it is, and look at me now, I'm more glamorous and than most, then they start believing. They said, oh wow, is this the way I can also look after treatment is done? So that is something that can come only from a person who's been through the experience. So I think support group is where there is this amalgamation of those who have been through the treatment and those who are going through treatment. I think it's the most amazing space where there's so much of positivity. Anybody who used to walk into our support group for the first time used to say, oh gosh, this is such a positive space, because there is this energy of only giving, because the person who's been through the experience is just giving these positive vibes and telling them, look, it's all right, I've been through it. You're worried about chemotherapy, I've been through chemotherapy. You worried about your hair, look at my hair. You're worried about your skin, look at me. You worried about what you can do, look, I can do most of the things that you can do and better. So that's what a breast support group can bring to the lives of people. So I think it's all personalized support as well as support based like this as well.
That's exactly what I'm trying to accomplish
Exactly.
in my app as well.
Exactly. I would just like to add on to it. See, when I was going through my treatment, we didn't have support groups, right? And we used to wonder, our only knowledge base used to be maybe Google or maybe one or two patients we could speak to. But then we were not sure whether, we used to kind of end up confused. We didn't have the confidence to ask the doctor everything every time. We don't remember most of the things. So what the support group does is that you meet the people who are going through the same journey, right? They are also going through the same traumatic situations that you are going through. They are probably losing their hair, the skin is becoming bad, they're very weak, they are depressed, they need somebody to speak to and understand them during this time. So that is what the support group does. So when we used to go and visit the patients in the hospitals who are going through this treatment, would you believe that they literally would touch our hair and say, are these for real? They came back. Are you able to swim? Are you able to walk? Are you able to run? So there were so many questions, and all of them are answered by just being there. You know, they could see that we are fine. They could see we are fitter. They could see we are more than normal. And obviously, you feel nice about it. And you know that, yes, if they have come through it, I'll come through it soon. So
Yeah,
that is one thing. And the support group that Dr. Geeta was talking about, we have these meetings, and she's been heading most of the meetings. And let me also tell you, she's an amazing singer. So we rediscover ourselves there.
that's
You know,
amazing.
there are so many, patients who are good artists, who are good singers, who are probably doing so many things in their lives, which they also don't know. They forgot that they could do it. And this is the time that they rediscover themselves. And guess under whose guidance? With the doctors there. The doctors participate. We did a master chef, we did Mendi, we did Karwa Chauth, we did
Ranti.
Holi. You just think of anything, we did everything there.
So
So
amazing.
it's like a second home for us where we can be ourselves.
Wow.
Yes.
So for a person like me who never danced in life, I could do a stage performance there.
Yes.
So that is what a support group does to you.
Yeah.
And how to cope up with it is that you have to keep yourself busy. That's the biggest thing. But
Yeah.
only do whatever you can, never compromise on your energy, because a cancer patient, when going through a journey, needs a lot of rest as well. So you have to keep yourself busy, maybe start writing, maybe read, maybe listen to music, do whatever you feel like. In fact, do what you never got the time to do earlier.
Yeah.
So it's like we sink and we swim together. That's what a support group does. And that's what a family does to you. So we either swim together or we sink together. So I think everybody would prefer the latter and swim together.
That's so amazing. You said it all so well. So my next question is to you, Meenu Auntie. What is something that kept you fighting, or what motivated you the most through your experience with breast cancer?
See, frankly, before I was diagnosed with cancer, I was very, very busy. I think I was very busy with the job. I was busy with small children. I was busy with the family, and I never thought about myself. So how, so when this cancer happened, it was a time to, take that pause, to know what life is and where things are going and what I need to do, you know, and how do I proceed from here on. So the family is one thing, your children are one thing that always will motivate you, that you have to get up and do that bit. And also there was something in myself that I wanted to prove myself, you know, that there is nothing, nothing can beat you till you give it up. So it's like no defeat is final till you decide that it's over for you. And I never wanted to do that. So I thought that maybe this is the time God has given me to spend some time with my family and to enjoy the little things in life that I was probably missing because of work. So I took that pause and it really kept me going. So I started enjoying the little moments in life, spending time with my children, with my family, probably cooking up little few things whenever I had that energy, and just connecting with friends and everybody I wanted to connect with. Then
Yeah.
I did a lot of reading. So a lot of things. I think that is what keeps you going. So do whatever you never got time to do earlier during this time and rediscover yourself.
Yeah. So could you say that your mindset has maybe changed in a more positive way now, and you've learned more about yourself since having?
Absolutely, absolutely.
That's so good.
I suddenly discovered, maybe Dr. Geeta will second that, I become a script writer for her.
No, Meenu writes beautifully.
we
Meenu
come up
got the art of writing. Yes.
we come up with new ideas every day, how we can spread this awareness and how we can do more about cancer, and we joke around and we all party together. Only this COVID is stopping us, but you wait and watch, we are still going to party.
Yes.
And that too together. It's going to be a virtual party, but we will do it. We are never
Yes.
going to stop.
So what advice do both of you have, or what is something you both would like to say to an individual who just found out about their cancer diagnosis?
So, somebody who's been diagnosed recently, it is not easy. However much we may say, however positive that person may be, that moment when this bombshell is dropped, it is like a bombshell. Whatever you may say, it is a bombshell for the most positive of people. But it's just that your coping mechanisms are different. But nobody gets used to the idea, oh, I've got cancer, so it's never like that. It does shock you. But my advice to everybody is that you have to understand that this is another disease. And I also think that, just Meenu said, that it gives you an opportunity to hit the reset button and do things in life differently. So cancer does give you that opportunity. Think of those people who get caught in road traffic accidents or have a massive heart attack or a big stroke, which does not even give them a second chance to just tell their near ones how much they love them. So it can be that bad, but cancer is, in that sense, not that bad. It gives you an opportunity to reset your equations with most people around you and with your own self, which is not the virtue of most diseases. So if you can live with the diabetes, if you can live with the hypertension, why can't you live with a cancer? It takes time to come to that point, but I can assure you that more and more people are coming to that point when they start thinking, oh, well, I know it's those 8 months of my life, I'm going to set it aside to get better, and then look at life beyond that point and live it better than before. So I think, you don't have to be scared of it, because with the current treatment and the amount of research that has gone into breast cancer treatment, things are looking so much better for everybody.
That's so well said. I'm sure anyone listening to this would find so much hope in everything you just said.
And to add on to this, I'd say, see, a breast cancer surgery is like losing a part of your femininity, right? I'm sure a lot of females who are young or middle age or whatever age group they are, it does make them feel a little awkward, I would say, that, how to cope with this now. But let me tell you, there are a lot of things, a lot of young females who have gone for a plastic surgery. And even if not plastic surgery, you really don't need all of those things later on. So it's like you you bounce back. I can show you people, and in fact, we have also done it. We have done the ramp walks. Now, can you imagine a middle-aged, okay-looking kind of a female doing a ramp walk? But then now she's a cancer champion. वो तो glamorous हो गई, celebrity हो गई वो तो. इसीलिए it's like you can do it better.
Yeah.
So it is. You have to know that whenever somebody is diagnosed with cancer, it is a phase that will pass. It is not going to be there forever. There are other treatments which are worse and can leave you in a very, very bad state physically and mentally. But cancer is a phase wherein, if you want, you can rediscover yourself, come out better, and I guess more energized and rejuvenated and very high on life. So it is a treatment that will pull you through your darkness and put you into light. The only thing is you have to know where you're heading. If you want, you can just, give up and just sink, or you may just rise from the ashes. It's like that.
Wow, you said that so well. Okay, so to end this meeting off, I kind of wanted to show both of you the app that I'm trying to create, maybe walk you both through it and seek some suggestions from it. So I'm just going to share my screen. Give me 1 minute. Okay. Can you guys see my screen?
Yeah.
Yes.
Okay, so this app is called Can in Cancer, and basically this is the home page. So it starts off with, you regularly log in, but if you don't have an account, you have to sign up. And the first thing it does is it asks you a series of questions about yourself, like what's your name, your age, what gender you are, what type of cancer you have or you had, what stage were you or are you currently on. Um, oh, sorry, 1 second. Yeah, your address, your email, and just a series of questions. And then this terms and conditions page pops up, advising users not to share any medical information. It also tells users how they will be matched with one another. And just, I'm trying to be as detailed as possible about the privacy settings. And once you click on, you agree on the terms and conditions, this app will match you with another user with a similar experience. So it'll match you with someone with maybe a similar age, a similar cancer, similar stage, so they can maybe connect with one another and talk to each other about their stories. So you can just click on their name to talk to them. But for example, you're not connecting with them really well, or you want to find someone new, or maybe the user was sending inappropriate messages, you could switch to somebody else and a new individual would pop up. Same thing, it'll show how similar you guys are and you can communicate with them. In addition to this connecting feature, the app also includes, so again, these are all your messages with people. The app also includes a calendar feature. And in this calendar feature, you can maybe mark doctor's appointments or anything else. And in addition to that, it also has a stories feature with stories from strong cancer champions around the world. And you can maybe click on their story. And I've written like a short, they've written a short story about their experiences. I even have your video in there, Meenu. And in addition to that, I also have a search feature where I provide nearby wig stores, nearby restaurants, nearby hospitals, near the user's location. And I also have a resources feature. This feature will include our current webinar about the relation between COVID and cancer and any other tips. I also give like treatment suggestions, book recommendations for cancer patients and survivors. So yeah, that's basically my app currently. And I'm also going to have a reviews feature. So yeah. So do you guys
Very
have any
nice.
suggestions or thoughts?
So you've designed this all on your own.
Yeah.
So what are you? You're you're interested in medicine, or you're interested in the the technology bit of things?
I guess I'm
We're
interested.
multi-talented.
Very
Thanks so
good.
much.
For your age, I think you've got maturity far beyond your years.
Thank you so much. Yeah, this is just currently the mock-up, but I'm gonna make this app come to life in the next few months, and I'll put it up on maybe the App Store. I'll send it to any NGOs or hospitals that I know of in Singapore. So yeah.
So it is kind
Excellent.
of going to be something like a support group that we have, right? So wherein
Yeah. The
people
only
will
thing
be
that I
connecting
noticed there
virtually.
was you had one of the survivors, or whoever you had, was 15 years old. You have to be careful when you have 15-year-olds, because the information that they can pass on can be needs to be regulated, because they are not in a position to. Uh, it has to be under supervision, under adult supervision.
Yeah.
So you'll have to work on that, because I just saw a 15-year-old in that. So.
Yeah. Okay. I'll be careful with that.
Yeah, because in your terms and conditions also, I think it should be mentioned that for younger uh, cancer patients, you would need to have some adult supervision of the content that is exchanged between the two.
Yeah, I'll make sure to add that.
Gayatri, I think you missed out something on the caregivers.
Oh,
You
yeah.
could add something, add a page there, maybe for the caregivers. You should
So
be
in the
able to guide
resources
them.
page, probably in the resources page, you could possibly add something for.
Yeah, that's a
Yeah,
great idea.
because a person who is, going through cancer does need all the help from the caregiver, because most of the time they are not so physically fit and mentally fit.
Yeah.
They might require somebody to talk to, and a caregiver is somebody who would influence uh, a lot during that time.
Yeah.
So the caregivers also deserve to be applauded and also given that kind of information, how to go about and take care. You could probably put in something there for them as well.
Yeah, I will.
And also ancillary services, there are things that the information out there is very, very sketchy, and that is things like physiotherapy, diet, stoma services, stoma clinics, because stoma is a huge part of those patients who had a tracheostomy or a colostomy or an ileostomy. These are basically those patients who need bags, and it can be quite uncomfortable if you don't guide them through it. So you can have separate sections actually slowly as you build the space, because the needs of different cancer patients is different. So your breast cancer patients, the needs are different. If it is a GI cancer patient, the needs are different. If it's a head and neck cancer, the needs are different. So you will have to have separate pages for each of these, and then focus on those specific needs, which are very rarely addressed. So we have a breast support group, but if you look at the other support groups, they are not so this thing. And there is a reason to it also, because like I said, breast cancer patients tend to do well. So you have, you can have a
Survival
long
rate is better.
sustained relationship, unlike other cancers where the chances of recurrence is high and it is hard to bring them on the survivorship. But I think somebody needs to make a concerted effort to get them on board also, because I always think a support group keeps you in a positive space, and I think it affects outcomes also, although I don't have any real hardcore evidence to show for, but I think it does help.
We are there. You
You
can
are the
have a look
evidence.
at us. Yes, I am the evidence. A lot of others are the evidence. We
True.
could never be the same because without all the guidance, because this is something we learn the fun way. Like वो बच्चों को कहते हैं ना, play school. This is our play school. We go, we play, we learn, and we come back better.
Yeah.
And
It's like
come
that.
and be there uninhibited. You don't have to prove a point to anybody in life.
Exactly.
Once you've
Just
been through
be
cancer,
yourself.
you just don't have to. So you're just yourself, and always a better version of yourself. So I think
And who is bothered whether you're wearing a prosthesis or not, or maybe you're looking a little crooked here and there. It's okay. Everybody's looking like that.
Yeah.
So it's good. You could see people from this length hair to maybe longer hair or maybe no hair. So it's okay.
Yeah.
We all are alike.
Yeah.
So it's
yes.
like us. The breast cancer support group is we are us. We are nobody else.
Yeah. So well said. Okay. Well, thank you both so much. I've learned so much about, cancer and support groups and about the relations between COVID and cancer. And I'll make sure to send you my app as soon as it's complete. So
Sure.
thank you
And
so
we
much.
would also
Great.
like to send you any suggestions we think of later on. Don't worry on that. And it's been a pleasure.
Yes.
Okay.
All the best to you,
Thank you so
Gaayatri.
much. Have a
For
nice
this and
day.
everything else.
Okay, I will.
Okay.